Hey everybody, really bad news. In an act of total betrayal, the CDC has come out and published their new vaccine schedules for both the children and adults alike. And guess what? As we covered back in October, they've added COVID-19 vaccines. 3 shots for the children for Pfizer, 2 for Moderna, plus the booster. It's absolutely absurd. So a lot of the COVID hype, a lot of the fear-mongering has died down a little bit, simmered down. But I think that's so they can slip in this type of crap, hoping it'll go unnoticed. So it's our job to make sure it doesn't go unnoticed. These shots are harming people. They can cause myocarditis. They can cause blood clots. They're messing up menstrual cycles. They're messing up sperm counts. And they want to give this to the children every single year of their childhood. 3 times in the first few months, along with all the other litany of shots on these schedules. I am so absolutely pissed off. So just today, February the 10th, they've published the new schedules. Hoping you wouldn't notice, they added the COVID shots to the child and adolescent schedule and to the adult schedule. You can see here, last reviewed February the 10th, 2023. So let's start with the child schedule. You can see the vaccine onslaught that they're putting all the children through, forcing the children to take on all these shots. But look here, COVID-19. 2 or 3 dose primary series and a booster. And they're not ruling out the additional boosters. I think we can all see that it's going to be an annual booster, if not more. This is disgusting. So 2 or 3 primary series shots and then a booster. So that's 3 or 4 shots. And that's just what they're asking now. We all know if you give these freaks 2 weeks, they take 5 years. This pisses me off so much. So they mention one booster, which is bad enough, but then they say, see notes. See notes. What are the notes? For booster dose recommendations, see this webpage. cdc.gov/vaccines/COVID-19/clinical considerations/interim considerations US. So these are just the interim considerations. You can also see here they're saying the primary series is 2 doses for Moderna, 3 doses for Pfizer. And the 3 doses of Pfizer are given for ages 6 months to 4 years. It's 2 doses of Moderna or 3 doses of Pfizer. And these 3 doses of Pfizer are given within 3 to 4 months. So it's about a shot every month for 3 shots. And then for the 5 to 11-year-olds, they're saying that you only need 2 doses of Pfizer. And then for age 12 to 18, also 2 doses of Pfizer. But if we go to this page on the interim considerations for the booster shots, so please note that this is a web link. They can easily change this website. I don't know if they have to do a whole meeting about it, or if they can just say, oh, now you have to take a booster every 3 months, or every year. But it just says 2 or 3 dose primary series, and a booster. See the notes. And then it's like interim guidance on the booster shots. So it's so obvious. These people are so transparent that they're going to continue to expand and expand and expand. And they're trying to slip this in under the cover of the night when everybody thinks we're going back to normal and the COVID narrative isn't dominating everybody's life. They're going to slip all this crap in. 3 shots on top of all of these other heinous injections. 3 more just added in like it's nothing. So something here I think is really important to note. If you look at the youngest age bracket, age 6 months to 4 years, they say take 2 doses of Moderna a month or 2 apart, or 3 doses of Pfizer within 3 to 4 months. So a lot of people will be looking at where their children lie right now. So maybe you have a 7-year-old son. So you're eyeing this line. Oh shoot, they're going to make him take 2 shots, which is bad enough. But let's consider how this will work once this is on the books. When children are born, they're going to be subjected to all of these childhood shots as a condition of going to school. And then when they turn 6 months old, they're going to be pushed 2 Moderna shots or 3 Pfizer shots. I can already hear it. Oh, sorry, we have a short supply of Moderna. You'll have to take 3 Pfizers. Who knows which one's even worse. But this is a ton of shots to throw at children all at once. It was a lot of shots before they added these new shots for COVID. And the worst part is we can see what they want to do with COVID. They want to turn these shots into an annual ordeal and get these on the books, enforce these as part of the childhood schedule. This is the foot in the door or rather a huge leap through the door, putting this crap on there. So I just want to bring extra attention to the fact that new children who are being born, new babies, will be subjected to all of these shots. And they'll hit this 2 or 3 dose primary series and booster. COVID shots now. So again, it says see notes. You click see notes. For booster dose recommendations, see our interim considerations. The definition of interim, adjective, provisional or temporary. Wow, this is crazy. COVID-19, interim COVID-19 immunization schedule for persons 6 months of age and older. So Table 1A is Moderna for children 6 months through 17 years of age. Table 1B is Pfizer-BioNTech for 6 months through 17 years of age. Okay, so let's look at this chart. For Moderna, 6 months through 5 years. They say take 2 doses of the monovalent vaccine, which Peter Marks at the FDA says is very poorly effective. Listen to this.
Why a 2-month gap as opposed to, say, a longer period of time?
Here. So this is a benefit risk consideration. So right now we have the BA.5 variant, which is close to 90% of what's circulating. What we gave to people originally is very poorly effective against symptomatic disease from that BA.5 variant.
But after those 2 doses, you're still not done. Then you have to take the booster dose of the bivalent vaccine. It really seems like they want everybody to take this series, which is extremely suspicious. Maybe it's a binary weapon of sorts. Maybe it's something like the PZP sterilization vaccine. But for moderately and severely immunocompromised, they have to take 3 doses of the primary series, the one Mark says is very poorly effective, and then a 4th booster dose 2 months after. So it's really remarkable that they're still pushing the monovalent vaccine or the bivalent vaccine. It's all crazy to me. So at just 6 months old, they'll be asked to take a shot, and then a few weeks later, another shot. And then if they took the Pfizer brand, they have to take a 3rd shot of the primary series. The shots that Peter Marks call very poorly effective, the monovalent shots. And then they'll have to take the booster shot just a few weeks after that. This is atrocious. This is diabolical. So now we'll look at the table for Pfizer-BioNTech. For 6 months through 4 years, 3 doses within just 3 months. And this is the primary series for this group. 2 monovalent vaccines, doses 1 and 2. And the bivalent vaccine is dose 3. So this is a bit confusing because on the actual table, it says 2 or 3 dose primary series and booster. And then when you click see notes, it says 2 dose series of Moderna or 3 dose series of Pfizer-BioNTech are the primary series. And then they say booster after that. But then according to this table, for Pfizer-BioNTech 6 months through 4 years, it seems like the 3rd dose is the bivalent vaccine. So I'm not sure where the booster is here. They seem to contradict themselves. This manic, insane bureaucracy. So that's all I really want to cover from this table. They're still using the monovalent vaccine for many of these doses, begging a lot of questions as to why. Why are they so hell-bent on making people take that serum and then the secondary serum? There could be some very nefarious reasons for it. So what about those of us who don't have children? Well, despite the fact that we might have children in the future who would be subjected to this crap, they just added it to the adult immunization schedule as well. This was added today, February the 10th. Right at the top of the chart. COVID-19. 2 or 3 dose primary series and a booster. See the notes. And then you can see all the other shots on there as well. So we covered this back in October, the meeting where they discussed adding these shots to the schedules, and actually voted yay on the motion. But I want to revisit some of that footage from that meeting, especially the part where they talk about it being EUA status. Somebody voiced concerns about putting EUA products on the childhood schedule. And they were like, oh no, our lawyers say it's okay. We'll be fine. It's disgusting. It's absolutely evil. Check this out.
The first edit is to add COVID-19 vaccines. Because booster dose recommendations are still evolving, we've included a link to the webpage with the most current recommendations.
But it's under an EUA. Is it okay for us to include that in the routinely recommended schedule if it's a EUA interim recommendation.
Yeah, before we brought this to the work group, we had a conversation about this with our Office of General Counsel, and we were told that it was okay to add it to the schedule. My name is Dr. Woody, and I'll present the proposed edits for the 2023 Child and Adolescent Schedule. The first edit is to add COVID-19 vaccines, and we've used separate abbreviations for the monovalent and bivalent mRNA vaccines. We also have a separate abbreviation for the monovalent protein subunit vaccine. Our table 1 is the routine immunization schedule by age. In table 1, we have added a row for COVID-19 vaccines, and we've shaded age 6 months through 18 years in yellow, indicating the recommended age for vaccination. We have also included an overlying text prompting providers to review the notes section for more details on the primary and booster vaccination. We've deleted the previous COVID-19 vaccination box, and we've added a new section for COVID-19 vaccination. We use the format, the age-based format in the infographics present on the CDC webpage for use of the COVID-19 vaccines. The routine vaccination section summarizes the recommendations for children and adolescents who are not moderately or severely immunocompromised. For the primary series section, based on the age of the child, we've included the dose series and the recommended interval between doses for each product. Because booster dose recommendations are still evolving, we've included a link to the webpage with the most current recommendations. In the special situations section, we've summarized the recommendations for children and adolescents who are moderately or severely immunocompromised. And for the primary series, we've included the dose series and the recommended minimum interval for each product. For booster vaccination, we've included a link to the web page. We also added a bullet reminding providers that pre-exposure prophylaxis may be considered to complement COVID-19 vaccination in this population. And then at the end, we've added a note reminding providers that an age-appropriate vaccine product should be administered for each dose. We've included links to the current COVID-19 schedule and the dosage formulations. And we also have a link to where the emergency use authorizations are located.
Just a point of clarification. I know that we have already recommended COVID-19 for children, but it's under an EUA. Is it okay for us to include that in the routinely recommended schedule if it's a EUA interim recommendation?
Yeah, before we brought this to the work group, we had a conversation about this with our Office of General Counsel, and we were told that it was okay to add it to the schedule.
And I'm going to ask first if there's any clarifying questions about this motion to approve the recommended child and adolescent immunization schedule and the recommended adult immunization schedule for 2023. I don't see any hands raised at the moment. And do we have everybody on screen?
Yes.
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 Yes. Yes. Yes.
Yes. Yes. Yes.
Yes.
Yes.
Yes.
Yes.
Thank you. Dr. Morton?
And the motion passed 15 unanimously in favor.
What's the best way to convince a parent to get a vaccine is to have an outbreak. And so that's it. Fear sells. Sadly, people are compelled much more by fear than reason. What's the best way to convince a parent to get a vaccine is to have an outbreak.